Every tool this series has covered can fail. The scan reader can miss. The scribe can mishear. The prediction can be wrong. The question that separates a safe system from a dangerous one isn't whether AI gets it wrong, it's what happens next. Tonight, the 4 ways medical AI fails, the people who catch it, and what happens when they don't. Because the pattern that protects you isn't perfection. It's checking. Health Tech Frontier. Failure number 1, the miss. You know this story from earlier in the series, a sepsis prediction model running in hundreds of hospitals. When researchers at one academic medical center tested it against 27,000 patient records, it had missed about 2/3 of sepsis cases at its alert threshold. A tool built to catch the deadliest emergency in the hospital, walking right past most of them. The miss is the quietest failure. Nothing beeps, nothing flags. The screen simply stays calm while the patient doesn't. Failure number 2 is the opposite, the alarm that won't stop. That same model, when it did fire, roughly 1 alert in 8 pointed at a patient who actually developed sepsis. The rest were noise, and noise trains people. Researchers warned that's exactly how clinicians learn to tune alerts out, until the 1 alarm that mattered gets dismissed with the 7 that didn't. A false alarm doesn't just waste time. It teaches the humans to stop listening. Failure number 3, the error that doesn't fall evenly. The pulse oximeter, the little clip on your finger, is one of the most trusted devices in medicine. In 2020, researchers reported in the New England Journal of Medicine that the device's readings don't hold equally for everyone. Among patients whose readings looked reassuring, Black patients had nearly 3 times the rate of dangerously low oxygen the device failed to flag. The FDA itself lists skin pigmentation among the factors that can affect accuracy, and issued a safety communication in 2021. Same device, same reading, different risk, depending on who's wearing it. And failure number 4 lives in us. It's called automation bias, the pull to trust the machine's answer over your own judgment. In a systematic review of clinical decision support, wrong automated advice was followed in roughly 6 to 11% of cases. And in one study, about 5% of the time, clinicians switched a correct decision to an incorrect one because the computer suggested it. The tool doesn't have to fail for the system to fail. It just has to be trusted a little too much. So, who catches all this? Look at how every failure in this episode was found. Somebody checked. The sepsis model was caught by researchers testing it against reality. The pulse oximeter by clinicians comparing it to blood tests. The scribe's drafts by the clinicians who review and edit before signing. That's the architecture this series keeps pointing at. The triage tool that can't decide, the draft that isn't real until signed, the medical no a physician has to review. Independent checking isn't bureaucracy, it's the immune system. And when a failure is confirmed, the machinery is slow, but it exists. The FDA issued its pulse oximeter safety communication and has kept pressing on performance standards. For AI triage software, the label must disclose known failure conditions. Certified record systems have to show clinicians how the predictive tools they ship were tested and keep showing them as the tools change. None of it is instant. Most of it happened because someone published, someone reported, someone asked. Which leaves accountability. Today it's shared. The clinician who signs, the hospital that deploys, the maker whose label makes promises. Where exactly the responsibility lands when AI contributes to harm. The law is still working that out, case by case. But your levers don't have to wait. Ask whether AI was part of your care. Ask what checked it. If a reading doesn't match how you feel, say so. Ask for another way to measure. And if the answer is a denial, appeal. 4 failures, 1 defense. Not smarter machines, although they'll come. Not perfect rules. There aren't any. The defense is the question this whole series was built on, asked out loud, by clinicians, by regulators, and by you. Is AI part of my care? And who checks its work? This has been Health Tech Frontier. Subscribe for the next chapter.